I think there are several lessons that we can take away. The first is that the time of denial is over. We don't see anybody saying they don't have a problem. It took a long time, but that's gone. I think we've got evidence now that our great theory, our great transforming concept, it's not bad people, it's bad systems, is valid. People have changed systems and they've seen it work. The evidence is there. There's not much question about that. We still have not made the progress we need on transparency, being open both within our institutions and to the public. We certainly need to do a lot better job in medical school. And overall, we're just sort of partway along on the journey. We have moved from the focus on individuals to the focus on process. I think we've gotten pretty well into, I think most hospitals understand that and are pretty good at it. A lot of people are really moving on team training, but we're far from the kind of organizational change and organizational commitment and mindset that it takes to have safe health care. There are some advanced concepts, if you will, that are gaining traction. That is, we are beginning to have the conversation about, which is the precursor for action, on teamwork, transparency, accountability, patient engagement, and this possibility of getting to zero defects. But we're still left with the fact that systems change doesn't do the job. The problem is the culture, and I would say it's even more than that. The problem is we have a dysfunctional culture, and the reason it's a dysfunctional culture is we have a culture of disrespect. I want to speak to you about this for a few minutes because I've become convinced this is really the most serious problem that we have to deal with, and it's one we haven't talked about very much. We have a hierarchical system that goes back hundreds of years in which the focus has been entirely on the expertise of the physician with assumed deference to the physician's wisdom and experience. This was a model that worked 100 years ago when the physician indeed could know all that you needed to know to treat people because there wasn't a whole lot you needed to know, and the physician could do all that. It's totally inappropriate in the modern era of multi-systemic, complicated, multidisciplinary, interactive, team-based, collaborative care. It's a broken model, but we're still turning doctors out in that model. Medical schools today are still producing a 19th century physician in terms of the mindset. The focus is all on individual expertise, not on as a member, not as an expert member of a team. And what we see in practice in our hospitals and elsewhere, of course, is a whole range of disrespectful behavior based on, I think, the way we've trained them, and then perpetuated by role models. We have at one extreme the disruptive physician, the person who shouts and screams and throws instruments or whatever. Very small fraction, although they exist in almost every hospital. Almost every hospital has one or two. And then we have a much more common physicians who engage in humiliating treatment of people and put-downs, all the way down to just the kind of passive non-engagement, which of course is disrespect, to not participate in teams for system change. That's disrespect. Down to treating patients badly, et cetera. And when you look at this, you find out, let me step back. This isn't most physicians, most of the time. It's just some physicians, some of the time. And all of us, to some degree, a little bit. Because we all feel entitled. I mean, after all, you know, look what we've been through. And so what you see is physicians in general are sort of equal opportunity disrespecters. They disrespect nurses, residents, students, patients, colleagues, and so forth. 95% of nurses report they've been humiliated by a physician. 65% say they've seen it or had it happen within the last 3 months. 100% of medical students, according to the students that were on our roundtable on medical education, 100% have humiliating experiences by their faculty. Patient stories abound. You've all heard it. Patient advocacy groups came not because of safety, but because of the way they were treated after their loved one was harmed. There's a whole host of bad stories the way people are treated. So disrespectful treatment is rampant in healthcare. The whole hours business is a matter of respect. You want me as a resident to stay up all night and take care of patients. You are putting me in a situation that you know will make me more likely to harm my patients. That's pretty disrespectful, aside from the disrespect for the patient who's a recipient of it. So what I'm suggesting to you is we have a very major problem, and it's time we address that, and it's time we do something about it. We don't have time today to go into it, but I do want to say that don't underestimate the power here, because the impact on safety is profound. If a physician treats a nurse, a resident, or a patient in a humiliating or really grossly disrespectful way, aside from their initial emotional reaction, what it does is it completely cuts off communication from then on out. No intelligent nurse or resident is going to call a doctor who treats them that way unless they absolutely have to. So gone's all the gray area, gone are all the debatables. That's a threat to patient safety. Certainly, with regard to patients, they're less likely to provide the information the doctor needs to know. So that right up front, that stops communication. Secondly, of course, the essence of teamwork, and the one thing we've learned in the last 5 or 6 years is that teamwork is how we make safety work. It's how we put in our safe practices. The essence of teamwork is mutual respect. What was the breakthrough with Peter Pronovost? It's when he got the residents at Johns Hopkins to agree that the nurse could tell them to stop the process, because they respected the nurse as much as they expected her to respect him. What does Atul Gawande say is the biggest barrier for implementing the surgical checklist? You know what it is? It's unbelievable. The hardest thing for them to do is have everybody introduce themselves. What does that tell you? So I'm saying these are serious things about safety, and it's something we've got to deal with.